Preparing to live stream. There we go. Good evening, everyone. And welcome to Medical Mondays with Dr. O. Dr. Toyin Okpesomi, popularly known as Dr. O, and I'm a physician in Maryland. I love to learn, I love to teach, and Medical Mondays just provides the forum to do that. Tonight, we have one of our very own, a former chair at NAPAC, a mover and shaker, not just in the medical arena, in all fairs that is worthwhile, our very own, I repeat, Dr. Nelson Aluya, who would cover the backgrounds of health for us today. Without much ado, Dr. Aluya, I'm yielding the floor. Welcome.
Yeah, thank you. Thank you. And thank you so much. Well, first, I must apologize. I couldn't make it last week, which again was what do you call it? Black History Month. But we as a people cannot be restricted to 1 month. Black history is celebrated every day and everywhere and all the time. And I was telling a group of Filipino today that I met, some healthcare professionals, and I again went back to talk about the history of where the Philippines came out from and how their ancestors left Africa over 45,000 years ago. And then with the M gene migrated up north and to China and then down to the Philippines where we have today to the islands and all that. So we as a people were the most diverse and significant and unique um, of all humanity on earth. And that's why we will not restrict ourselves to 1 month, but all through the year. So my presentation today is basically to talk about a primary approach to health, but also to tell us about the contributions that Black people have made in the healthcare industry. And a lot of the time we don't know this story. We often not hear about it because it's not in the mainstream. And with time, as time goes on, you tend to forget even your own history. And those who stood in the gap for you and created platforms that you and I are able to stand today. Dr. O looking nice and nice clothes and me with a tie, and Dr. Zugo in his lab coat, the stethoscope over his neck. There are people who paid this ultimate sacrifices from sweat, blood, and hard work, often ridicule and disgrace, but they stuck to it. And that's why we're here today. So I will take on the sharing. Let me pull it up. Yes, so you guys can see it?
Yes.
Right. Okay. So let me put it on. Good. Um, so as primary approach to healthcare, I just modified it a little bit, but again, we'll talk about the history of who we are, where we are, the contributions that Black people have had. So, Black excellence in medicine, pioneering through healthcare through history, and these are some of the people who, over time, we'll talk a little bit about some of them who have contributed to healthcare in this country. And often enough, we don't know their names. I was shocked by some of them myself and what they've done. And it took me back to come to the realization and the respect that we have for some of these people that otherwise we don't know. Like they always say, if a branch that does not know is part of a tree will only live but wither. What it means, because that branch gets its root, its food, its culture, its dynamics, its integrity, everything from that tree. And if it forgets that it is, then it's going to be cut off. So God forbid we'll be cut off because we do not know her history. So today is one of the reasons where we have to do this. So this presentation highlights the extraordinary contributions of Black individuals in the field of medicine, despite facing historical barriers and discrimination. Their groundbreaking work and unwavering commitment to patient care have shaped the healthcare landscape as we know it today. And some of these people are this. James McCune Smith, the first African American to earn a medical degree from the University of Glasgow in 1837, paving the way for future generations. He wanted to get into medical school here. They didn't allow him. He had to run and leave and go abroad so he can get uh, uh, healthcare, get into medicine and become who he is today. We have Rebecca Lee Crumpler, the first African American woman to become a doctor in the United States, publishing a book on medical care of women and children in 1883. I mean, amazing. When they talk about um, the discrimination or discrepancies between men and women, you see that our women have always been at the background and pushing forward. So our women just didn't go into medicine in the 1960s or 70s, as some people may think. No, we have people who went into medicine a long, long time ago. And this is who she is. We forget these people, but today, hopefully, we'll be able to remember some of these names, at least hear about them. So that tomorrow, when somebody tells you and asks you, who are you, you'll be able to confidently tell them, listen, I am from a stock that knows who they are, what they represent, and I cannot be diminished by any means, by any means necessary. So we have Dr. Charles Drew, who has groundbreaking work on blood transfusion. His work basically started um, revolutionized blood transfusion by developing methods of storing and preserving blood plasma, saving countless lives during World War. He faced discrimination, racial discrimination in his work, but remained dedicated to advancing medical science, inspiring generations of Black medical professions. You can imagine what the world would look like today without the work that he has done and the countless lives that have been saved by blood transfusion alone every day. And at this stage, whether you're white, black, or Jew, it does not matter. These are the work science explains itself, and who you are, once you dedicate to yourself to the duty and your discipline, you will excel, and irrespective of the discrimination that you may face, time would prevail, and your name will be put in the annals of history. We have leading research and innovations. Marilyn Hughes Gaston, a leading researcher in sickle cell. Gaston became the first African American woman to direct the National Heart, Lung, and Blood Institute. Can you imagine? This is something I found so profound. I know of the NHLB Institute, but I never knew there was a Black woman who became the first to direct it. I mean, this is just showing me, like, listen, I can boldly walk down the street tomorrow and say, you know what? Even if we lost our way somewhere, we need to reconnect to our roots of this excellence and great men and women who've done amazing work to get us to where we are today. So Jane Wright, cancer research should make significant contributions to the development of chemotherapy drugs, including the first effective treatment for rare type of skin cancer. I mean, can you imagine this? These are the work that these people do, and we see what cancer, therapy is doing today, and we don't even know that these people contributed to where we are today, and how far that they've done. One of the most profound researcher again is Solomon Kafula, a pioneer psychiatrist who conducted groundbreaking research on Alzheimer's disease. Groundbreaking, making significant contributions to understanding this complex neurological condition that we still live with today. Fuller focused on pathology and the treatment of Alzheimer's disease, including identifying specific brain abnormalities associated with the disease. Now, this is Fuller. This is Dr. Alzheimer's himself. They're named after the disease. And this is Fuller sitting down here. How many people knew that people like this existed? And this is the groundbreaking work that he's done. All the years they tried to diminish us, but you know what? Time will tell, and everything is being exposed. We have uh, um, people who've done exceedingly work expanding access and opportunities in healthcare. Mary Liza Mohani, a first African American woman to graduate from a nursing school in the United States, breaking down barriers and paving the ways for future generations in nurses. Daniel Hill Williams, a surgeon who performed the first successful open heart surgery in 1893, pioneering, procedures that advanced the field of cardiac surgery. We know the work that an African American brother did with Adibeki, who was diminished all through because he was black. But again, these are people who've done great, great and amazing work. So, what does it mean when it comes to improving healthcare in the African American community? We have William Gustus Houston, a researcher who developed a diagnostic test for syphilis. You know the story of syphilis, the Tuskegee research that was done. I mean, a disgraceful, pathetic research that was done on Black folks for syphilis that came all the way from the 1930s to way back in the 1970s as well. We know the history and why we as a people and Black African Americans are still very, apprehensive and suspicious of the healthcare system as we see it today. So his work, improving healthcare for African Americans who were disproportionately affected by the disease. Hinton's test simplified and made syphilis diagnosis more accessible, leading to what do you call it, improved treatment and outcomes. Contemporary leaders, Leonard Berry, a gastroenterologist, advanced the healthcare access to underdeveloped communities, championing equality and equity in healthcare. Otis Boykin, an inventor who developed medical devices, including the pacemaker, contribute to advancement of cardiac care. I mean, pacemakers are still being used today, temporary or permanent. We still see that. Kismeka Corbett, you heard about her during COVID. A virologist played a critical role in developing Moderna COVID vaccine, a treatment, a testament of our dedication and scientific brilliance. So we have always been a brilliant set of people, but again, these are some of the things that they want to make us feel, hey, we don't belong here, and we have nothing to offer. And it's a shame. But then every day as we live our lives, we have to debunk that narrative about us. And that's why wherever you go as a Black person, you're not just representing yourself, your family, you're really representing the entire Black race. And that's what we will take today and pass down to generations, even in our old age, as we sit down with our children and grandchildren. That's the kind of information we'll be able to share with those coming behind us so that they can walk down the street with pride and respect based on the quality of their character and not just the color of their skin. So, healthcare, impacting healthcare. We've done this with great resilience, continue to fight as we, say these things. We have professionals every day that are doing the work. And those coming behind us who are still doing incredible, amazing work as well. So it's a call to action where we acknowledge the contributions of Black pioneers in medicine, support organizations that promote diversity and inclusion in healthcare, advocate for policies that address the healthcare disparities, and improve access to healthcare for all. As Black people, that's what we believe in. That's what we always fight for. We're not like everybody else. When we fight for everybody. And it's a shame. Sometimes a lot of other people ride on our coattail to achieve success as well. We had histories with those. But again, we are who we are. So the next step, continuing the journey. By honoring the past, we can create a brighter future for healthcare. Let's continue to celebrate the contributions of Black pioneers, work towards a more inclusive and equitable medical field. Let's build upon their legacy, create a world where everyone has access to the care that they need. Now, addressing health disparities, contributing to communities, and preventive medicine. Black doctors have done such great work, critical role in addressing all of these issues. We continue to be dedicated to the work. We continue to try and close the gap as it may be. The numbers of Black doctors going to medical field has not really improved. And that's why on a daily basis, You may have to encourage your grandkids or whoever who's shown interest to come into medicine, but not just your kids or your grandkids alone. Listen, anybody in your community, anybody you know who has shown great interest and talent, encourage them. And if you can't do it alone, call members of your family community. Let put some money together to encourage these individuals because the number of especially black men in medicine is dwindling. And I often, sadly tell some people in the future, you may not see people who look like me who are male in medicine, but we as a people, not just doctors here today or those in healthcare, if you're industry, whatever you are, we will have to step up. There's a call to action. Let's raise young black men into medicine as well. So we know that COVID vaccine, the COVID industry or COVID, disease had a huge impact in our world, shut down everything, and our health was badly affected. Initially, when they came up and said, "Hey, you know what? Black people didn't die from the disease," but we eventually found that before COVID came, the disproportionate death that took place in Louisiana, in New York, in Michigan, especially in those critical areas, was far ahead than anybody else. Where the black population constituted in Louisiana about 20, about 63%. In Michigan, about 13% to 45, 15%. But the amount of people who were dying was up to 63% who were people of color. So again, these discrepancies or disparities come from a whole lot of issues. We have a biblical context with this, where it says, "What is man that God is mindful of him? Or what's the Son of Man that he will visit him?" God, in his infinite mercies, has created a divine value for each and every one of us, where he talks about not just the physical, the emotional, but also the spiritual health. That is what makes us as a human being. So again, that's what is congruent with us as a people, blacks, because we always connect to our spirituality. And that's what's making us, as unique and as peculiar as it may be. Some people will say, "Oh, we're that great or that peculiar. Why were we decimated the way we were?" Again, I'm sorry. Our sense of forgiveness and love for humanity has always also been our downfall, where we don't see evil in anybody else, but we see good. Again, things are changing. We will move forward. Timothy says, physical training is of value, but godliness is of value of all things, holding promise for both the present life and those to come. Physical training, huge, huge. Why did I put this here? Because I'll tell you this, and I always tell people this. If you look around, just pay attention. The fastest people on earth, male or female, are all blacks. The fastest people on earth, male or female, look around, they're all black. Why do you think so? Is it because we train more, we have more equipment? No, it's our genetics. We're made and coded like that. And that's why what they describe it as short twitch muscles or brown muscles, that's the kind of muscles that we have. But the advantage is that it makes us really move fast and do well. The disadvantage is if you do not move those muscles, then they denigrate because the muscles eat when you move them. And that's why all through from Africa in the 1980s, and I've said this here on this platform before, Africa was described as a continent without diabetes. But today, diabetes is ravishing the black community because we no longer move. And when you don't move, because of sedentary lifestyle, what do? You gain weight. And when you gain weight because the sugar that is supposed to be eaten up by those beautiful brown muscles that you have are not being eaten anymore. So the muscles don't eat, they denigrate, and you begin to gain weight. The sugar begins to circulate. And when sugar circulates for too long, what do you get? Diabetes. Diabetes is new to the black DNA. So if there's one other thing you have to take out of here today, please move your beautiful brown muscles, period. Because that's one sure way of keeping you healthy. So God bless you.
Movement is medicine.
Sorry?
I said movement is medicine.
Movement is medicine. So present life and the future. So Proverbs says this again, joyful, spirit, spirit, spirit. It's important, a positive mindset. Why did I put this? Because one of the things that has been such a drawback in the Black community has been the mental aspect of our life. We're spiritual, but we're not connected to the mental aspect of life. And as the world is changing, we begin to tap him back and see that the things we used to wing, we can no longer wing them. We need to begin to pay attention and know that, look, your mental health is important. And the children that we have and those who are coming after us see and view things differently. But I've always said this: you don't have to be um, westernized, even when you're civilized. And I'll say it this way again: it is okay to be civilized, but you don't have to be westernized, meaning adapt other people's values that not truly yours. In the Black community, whether African American or Black home, we have our values, and we must begin to stay to those values as well. The Chinese are doing it, the Indians are doing it. I see no reason why in the Black community we can't do that. Those values of culture, of raising our young ones and loving them as a community, we're losing all of those things. And we can't. It's imperative, because those are the things that preserved us so well and preserved our mind with the issue of mental health, because the village raised that child. And when you lose that village care, your mind is exposed to the wilds. And unfortunately, that's what's happening. So again, these are some of the things we need to be our neighbors' keepers. The Bible says that so eloquently. But then we also, recognize when there are mental health issues going on, so that we can begin to address them at all. So same thing as we move on. So when it comes to the healthcare, I've broken down this into certain areas. But one of the second thing that you have to take out of here, if you do not have a primary care doctor, I would have asked show your hand, but I can't see everybody's hand. but what it means is this: look, you have to have a primary care. Period. There's no other way around it. You have to have a primary care, because a primary care doctor is the same one person who you sit and talk and address your issues with. That person who will know you, know who you are, know what you do, know your history, and know where you were, and God forbid, wherever anything else is going. Because research has shown that those who have primary care doctors actually do better than those who don't. Unfortunately, in our community, we often use the ER as our primary care. The emergency room, something happens, we run to ER. Those guys don't know you. And you're just a number to them. And unfortunately, if you come with something so mundane, they get angry.
Or urgent care.
Or urgent care. They get pissed off. They don't want to see that. You understand? So, but you want somebody who would see you, sit with you, address your issues, and know you as a person, and you have a relationship. And I often say this: if you have an accountant, you have a mechanic, you as a human being need to have somebody who would address your health issues. We saw the decadence and the exposure that COVID did to our community, not just to our community, the healthcare system globally. So again, if there's one thing you take out of here, you have to have a primary care doctor. One, why? Because prevention is huge. Your primary doctor will sit and review with you preventive measures. I always tell people this: look, in a year, you have one time where it's mandated that you sit with your primary doctor. You have 30 minutes to sit with your doctor, where you address all of these issues with you. Any other time is 15. And those 15 minutes will come and go so fast. And that's why a lot of people come and like, oh my God, the doctor he just went and said hello, and that's it. I barely heard what he said. He's just writing prescriptions. But when you have an annual well visit, and it's your right to determine that and decide that. So if you don't have a primary doctor, go get one today. Even if you're a doctor, for God's sake, get one. And then set up an annual well care with your primary doctor. He'll sit with you 30 minutes. It's the law. You can time it. Doc, I have 30 minutes for you today. You're not running anywhere. And then you can sit and discuss those issues. What are my primary issues I have? Doc, cancer runs in my family. Breast cancer, prostate cancer, all of this. And one of the things we talked about, and I think here and the other platforms we talk, cancer in families. We'll begin to know that if you have breast cancer runs in your family. There's an 8 to 10% chance of the men in those homes getting prostate cancer. And if prostate cancer runs in those homes, there's also a 15% chance of you getting breast cancer. So it's a vice versa. My God, we never knew this. But now we're beginning to know. So that's where the doctor will sit you. Kidney disease, kidney issues, rampant in the Black community. We can talk about that subsequently. Your heart disease, if it runs, diabetes, that's when you talk about all of these things. Share your primary of history. We don't do that in our community, but it's time to share with your doctor, and then early detection, where if anything is coming up, they can catch it and nip it in the bud. Early biopsy, before the disease spreads to become something else. They detect it early. Kidney disease, before it progresses to end stage where you end up for dialysis. Because I always tell people dialysis is a disease in itself. And what most people don't know, once you get on dialysis, I'm sorry to say, unless by careful dedication and preservation and care, on the average, most people spend 8 years on dialysis. 8. That's not normal. A machine cleaning your blood, it's not normal. So you don't even want to get there in the first place. So that's where they'll put you on medication, give you advice, what you want to do, all of that's what you can do with your primary care because he knows that. And then your primary care knows that you have all of this and say, you know what, don't take this medicine, don't take this medicine. If anybody giving you this, do this or call me first. And then the third part, continuity of care. We'll be able to continue the care that you have. Hey, diabetes, your A1C is 15. Be able to watch that to the point where A1C comes down to less than 7. And then the risk of strokes and kidney failure and all that is eliminated because the continuity of care and took care of you to where you are today. These are the reasons why you have to have a primary care. It is crucial that you have one to maintain your health care, a good health. Now, before you do that, research your doctor, for God's sake. Look him up. We live in an area where you have the internet now. Somebody gives you Dr. Aluya. Who's this damn Dr. Aluya anyway? Let's look him up. See does he have bad reviews? Check his credentials. You understand? Where did he go to school? How far is it related? All that. You understand? But make informed choices when you choose your doctor. Often enough, referrals. Sometimes you're like, oh, that mechanic is really good. Oh, that tailor who sews your ashwabi or that is great. And you run to that tailor to go sew your clothes. But when it comes to a doctor, you don't want to take the time to do all of those. It is time because it's your health. Outside of your health, everything stops. God forbid if you get sick today, everything stops. It stops. And not just that it affects you, it affects your entire family. If you're laying in the hospital today, your family has no choice. Friends, they'll have to drive, park their car, come climb up, pay their toll, whatever, and come see you in the hospital. And God forbid, in the process of going to the hospital, they get into an accident. If you were not there, that will not have happened. And that's why we need to preserve ourselves, preserve our community by also taking care of ourselves. Be responsible for yourselves as well. So as you do that, references from family members. Oh, I got this doctor. He's so great. Dr. Kwesame, she's in, Maryland. And where's our office? Because they already know it's tried and known. These are the things that, as you pick a primary doctor that you also will have to do. Now, preparing for a doctor's visit. I think I've said this here before. Look, I always tell people it's like going to church, and I'll speak a native tongue right now. For some of you who don't know the Benin language, right? Benin is the Great Benin Kingdom of Edo State in Nigeria. He said "Upon or Idomo." What does that mean? You are dressed the way you are dressed. Period. And that's the way they say it in English. It's like going to church. You put on nice clothes, look well. A patient came in, I think, sometime this week. You're like, you're well dressed. You're like, yeah, Dr. Aluya said I need to come here looking well dressed. That's a fact. You dress well when you come in. Because when you come in into the office, the people you sit with, the front desk, they will give you value and respect just because the way you look. It's only human nature. It's not about race. It's not about, anything else. You dress well, you come in, just doing that alone makes you look confident. Just like the doctor. The doctor dresses well. If your doctor comes in and is looking worse than you you will not automatically, your trust from that doctor drops from 90% to 65. You don't want to see that kind of a doctor. No. So before you go, get dressed, clean up, prepare your day before you go. Now, what does that mean? What do I mean? You have to sit back and review. What are your allergies? What medications do you have? What's your medical history? If you don't know these things, write them all down. Write them. Because the very first time you see a doctor, which is your initial visit, you also have 30 minutes. 30 minutes. So you can write all of these things down. And that's why sometimes they ask you to fill out those forms, because the doctor want to see those things, what you are, what you're on, what's your medical history. Document all of this. You document your surgical history. If you've had any surgery, if you've had anything, you document. I saw somebody today. It's a patient of a colleague of mine, and I saw her, and no, I think I've seen her before, but she came as a patient of colleague. I've seen her once, and I did to take care of her, and then today she's like, "Oh, I have this pain, this stomach and acid and all that," and I was cracking my brain like, "What is wrong?" And looking at the differential, is it acid reflux and all that and all that? Until she said something, she's like, "Doc, I'm on this weight loss medicine, which is semaglutide. You understand? And I know those meds give you GI symptoms." So, and I said, "Thank you for telling me." Because guess what? If she hadn't said it, I would not have known. Sometimes I would ask, like, "Oh, are you on any other medication? What are you taking?" But if you do not ask or they don't tell you, you will not know. So immediately she said that, the differentials, boom, it was a lot easier and to address. So that's why it's important when you're seeing your doctor, you document all of these things, the medications, all surgical history, family history, what's happening in your family. There are families where they run with cancer. If that's your case, listen, it is okay. It's just the gene that you have. So what do? You tell them so that they can screen you for all of those cancers. I had patients that have leukemia. It's a genetic condition where they have, cancer and they run in the family. So I screened them. There's one. I even asked them to do an MRI of the brain and find out new lesions in the brain. It's not a standard care, but because of our history, I did all of that. That's why these things are important. So know your family history, like I said, what to identify this cause. We'll do early screening and preventative care, like we just talked about. Documenting your complaints. Now, when you come to see your doctor, you document your complaints. A lot of times, some people come in, "Oh, I have pain here, I have pain here, I have this." No, you know what? Write it down in area priorities. What is most concerning to you? Is it a headache? Is this the chest pain? Now, you can tell the doctor, in your head, the headache is more important to you. But guess what? You may tell the doctor, "Well, you know what, doc? I also have chest pain." And you're like, "Really?" "Yeah, when I walk a little distance, I have pain and I feel short of breath. And you know what? I can't walk up to 2 meters without having to stop." That's blood flow issues to the leg. And they may actually reflect what's going on in your heart. So the doctor, to you, the headache is your problem because you think, "Oh, you may have cancer of the brain," which most likely the risk is very less. But the one that is going on in the heart is so much more. So the doctor will be able to prioritize all of those things to take care of you. And in doing that, it makes it easy to the point where you're able to communicate better with your doctor. That's effective communication. Because communication is, I speak, you listen, you speak, I hear you, I listen. And then we'll be able to flow in the right direction to rational, reasonable, objective conclusion. And that's what an encounter with a medical doctor is all about. So prioritizing your signs and symptoms, and then creating an avenue for effective communication. So if effective communication, I mean, huge. I can't overemphasize that. Partnering with your doctor, review your symptoms openly and honestly. Ask questions to clarify. If they use jargons that you heard and you don't understand, "Doc, sorry, I don't know what atrial fibrillation is. Don't pretend like, oh, you know what? I don't want to feel like, you think I'm a fool. No, he's the one that went to school, not you. Because in your space, he doesn't know what, differential equation is, because that's your space. He doesn't know. But so if you don't know something, you ask. Doc, sorry. I don't know what you mean, or what does this mean? You understand? So that you don't walk out of that place not understanding what you're saying. And if you have to, repeat it. On repeat, sometimes I tell them, and I ask patients, so what did I say, or what do you hear? Or repeat, some of those things to me for clarity, for understanding. And sometimes, when we're done, I say, come back in 2 weeks. And after a while, and I said, okay, so when did I ask you to come back again? And you'll be surprised. Some people like, oh, well, doc, you said 1 month. I said, no, 2 weeks. So again, we need to partner with your doctor, so we have this open dialogue, open conversation, and all is and ease, so that as you entrust your health to him, he can also trust you that you do the things that he has asked you to do. So in animal screening, especially for men, again, I put this one forward because men, we have our issues. Even the doctors among us too. A lot of us don't even go for physical physical annual check. But some of the things that are profound, that as men, when you go for your physical, these are the things you must ask your doctor, and they will prioritize them, and as such would also put them as risk levels based on what your history is. Because again, every patient that comes to see me, at the point you're sitting with me, you're the most important person to me right there, and that time. And I'll have to listen to you and do what is right for you, by you, and not by anybody else. So the blood work will screen for diabetes, screen for cholesterol. Again, number three, if there's anything you have to take out of here, know your diabetes status. You have to. Are you pre-diabetic, meaning borderline? Are you no diabetes? Or are you pre-diabetic? Or you have diabetes already? So you have to know. If you've never done that, go find out. Because diabetes will determine your quality of life, and even your lifespan. Honestly, that's just the plain truth. It would determine your quality of life or your lifespan. And the other thing you need to look as well is, protein in the urine, especially for Black folks. We talked about that earlier. We, unfortunately, maybe some questions will come up. We inherit a gene that increase our risk for kidney disease. Things we're beginning to know now, and 15% of us carry that gene in the community, but we don't know that. Who carrying it? We don't. I don't even know if I carry it unless I screen. So, but again, thyroid, you can't ask for urine, ask for your vitamin D. Vitamin D is huge again for the Black community. It helps with your mentation, meaning memories and mental alertness. When you feel so fatigued and tired, like draggy and all that, especially for those who live in the Northeast, because we haven't seen sun in God knows what, and we do, as Black folks, we work so hard. We do, extra hours. And for you who are doctors, you come in so early and leave so late. Your vitamin D is low. It reduces, the risk for diabetes as well, because we know the studies have shown that women who are pregnant, who have low vitamin D level, have a higher chance of gestational diabetes. And of course, that would affect their babies as well. And I've seen it. The more your diabetes, your vitamin D drops, the more your A1C kind of rises. If you look at it, it also goes along with your inflammatory status. So it also helps reduce the inflammation in your body. So vitamin D is huge, especially for us as Black folks. And that's why we have this beautiful dark skin. When I was growing up, they said, oh, you know what, you have to sit in the early morning sun. And that's the kind of sun that you need to produce your own vitamin D. Well, now we know, no, early morning sun for the other folks, because their skin is lighter, we are darker. We need a little more sun because of our gorgeous melanin. So we need, you know, midday sun or whatever. I'm not saying you should go out and bask in the sun and get sunburn, but you know, again, it's imperative. So check your doctor, find out what your vitamin D level is. They will just replenish it as soon as possible. For men, prostate. Age 40, everybody needs to be screened. Um, if you haven't, when you go to your doctor, and for the women who are sitting down, please, when you take your husband, because sometimes you have to drag them with you. Um, when you take your husband, tell the doctor, please screen for his what do you call it, prostate, because he runs in families, and we begin to see so many already, you know. And unfortunately, I think we talked about it on this forum, where there's a genetic, you know, predilection. Some people carry the genes, some people don't, for very aggressive uh, prostate cancer. So please screen that. And colonoscopy, again, we've heard the whole story, you know, Bosman who died and all that. Back in the days, I remember in medical school, they said, Lord, if you must take me, please don't take me by the rectum. And that's because, you know, colon cancer and all that. It used to be an old man's disease. And that's, if you look at the old books, it used to be old man's disease. But things have changed. Why? Is it because of the diet that we eat now? Our immune system, our protective immune system in our stomach is no longer there. All this, you know, refined sugar that we have has blunted our GI tract to the point where, which is a fact, I did say that the natural vegetable kind of food that you eat gives you the natural protection and wavy, healthy colon that you have. The more refined sugar that you eat, the blunting it takes. So again, is that the risk why we have more colon cancer now? Probably. Back in the days, they said 50 and above you screen. Now they came down to 40, 46. Today it's actually 45. So you screen, if it's normal, nothing there, clean, um, they'll screen again for 10 years. Now a lot of people say, hey, you know what, doc, it's so hard to drink that stuff. You know, if you're gonna do the colonoscopy on Monday, this is what I tell people this. By Friday, don't eat much. Eat less. Eat more, you know, liquidy. So that by the time on Saturday, Sunday, when you drink that stuff, you don't have nothing to go use in the bathroom. So your GI tract is really clean so that when you do the colonoscopy, the doctor will be able to see everything well. If there's a polyp, they're able to take it out. Now, if there's a polyp, depending on the type of polyp, um, you know, sometimes tubular type, they may ask you to do it in 5 years. And again, if there's some variations or changes in the tubules, they may ask you to do it in 3 years to repeat it. So that's what it is. Hepatitis screening is important. Hep C, big, especially if there's a history of drug use and all that. Hepatitis C is almost 300 times as effective as HIV. Most people don't know that. It's important to screen. Just make sure you haven't exposed, and those who work in the healthcare industry as well. Syphilis, syphilis stays in the system. It can be there for 30 years dormant, and there are 3 stages of it. So it's important we ask for all of this. So routine blood screen for men and women. Again, this screening cholesterol and all that. Then we go on to screening for women. Blood work, the same thing we just talked about. The men, pap smear. Look, pap smear, cervical cancer is the most preventable cancer in the world. It is, because you can literally just screen for it, and if it's there, you see it, and then, you know, if you have to take care of it from, you know, whatever stage to, you know, totally taking it off, then that's what it is. For those who are of certain age, and I tell people this: if you have a sexual intercourse and you bleed when you have sexual intercourse, that is not a good thing. It's time to have your pap smear done and screened to make sure that the cervix are not friable and cancer tissue take place. It's a shame that any woman in the United States will die for cervical cancer. Have we had them? Yes, but it'll be a huge shame. So please do your cervical cancer screening. These days, a lot of people do it every year. You don't have to do it every year. It's okay to do it every 3 years if it's all clean. If it's not, then, you know, you discuss with your doctor what the plan and strategy would look like. Mammogram, I can't overemphasize that. Unfortunately, we're seeing younger and younger age people, with um, breast cancer. I ran a cancer clinic at the university, while I was there, and I saw cancer from different types. Lord have mercy. And I saw young women in their 30s with breast cancer. Um, Please, you know the routine. Examine your breast. In the circle, just go on the YouTube, Google it, how to examine your breast. It'll show you. We live in a world where these things are available. They will tell you how to do it. You just look it up and YouTube it. You'll show you the whole process. And not just that, teach your children, the girls who are coming up as well. As soon as they begin to get to that age where they're developing their boards, have this conversations, because when you begin to have these conversations, especially who the mothers, these things would, be imbibed in their minds, so that down the road they will, know how to do it. And if you see a lump, look, if you see a lump today, check if you see it having your period. All right. Sometimes, we have changes in the ovaries that go along with that of the breast as well, where you have, breast tissue changes with your period. So if the lump is still there 1 day, 2 days, a week, after a week and it's still there, go see your doctor and say, listen, I see this. What should I do? If they have to do ultrasound, have to do a mammogram, then there is, especially if there's a strong family history. It's important. Again, colonoscopy, the same thing with women and men, um, as we do. And then DEXA scan. It's funny, most times we don't talk about DEXA scan mean osteoporosis in men, um, because men have bigger, stronger bones. So the chance of osteoporosis is much lesser, but it does happen. But if you look around, most of the times the women who eventually have broken hip when they fall. And that's why, again, I can't overemphasize move, 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 move. Because as you grow older, you have to have a routine exercise regimen. It's not jumping to the gym or whatever. Even if you do, good. But every day, just do a little something in your bathroom or whatever. Find a routine for yourself where you do the stretching. Because as we grow older, the tendons tend to shrink and they get stiff. And that's why when you were 17, 18, you could do the splits, right? But as time goes on, you never exercise, you can't do the split anymore. The moves that used to move, you can't do that anymore. If you tried one day, a bone cracks. Yeah, because you were not stretching. Those tendons are not being stretched. So, but if you stretch the tendon every day, it becomes routine, becomes part of you. I always tell people this: let that be like your coffee every day. A stretching exercise every day, because a muscle that is moved supplies the bone blood flow as well, and the bone still remains healthy. These days, sometimes I talk about omega-3, which is huge. That's another discussion we can have another day. But these things are really important for women as well. So the three types of visits that we talked about. Remember, I said the first visit, the annual well visit, where we just talked about those things for men, women. For sick visits. Now, a sick visit is usually a focused visit where, doc, I have a headache, or doc, I have pain here. That's what brought you to the doctor's visit. Once you sit, they're going to address those issues straight up. You're not going to see a doctor, and when you sit down, like, oh, what's the problem? Oh, I forgot. I don't even know, or whatever. And if you notice, a lot of the time when you get to a doctor's office, the same problem that you had that brought you in, by the time you get there, the pain is no longer there. But at least if you document those things down and come specifically, be intentional when you meet your doctor, so that you address this issue is, symptom-based, focused visit, and they address those issues. But guess what? Once those things are gone, if you still have any other concern, please discuss with your doctor and go back. Look, the fourth thing you take out of here, once you see your doctor, always, always get a follow-up visit. Always. It may be next year. Let the doctor tell you come back next year. Please. Always ask, doc, when am I coming back? We tend to forget this. And doctors, a lot of times, don't even ask. So, come back. No, and we don't want to come back anyway. No, look, even if it's a year, doc, when am I coming back? I'm coming back in 1 year. Okay, fine. It's 1 year. What that means is everything is clear. You're good for 1 whole year. But guess what? If you fall sick in between, you have a cold or whatever, you can always call back, set up an appointment in between. But at least you know that the fundamental basic things, you're cleared of those. Now, fifth thing you're going to take out of here. If you do any test, please ask to follow up with the doctor maximum 2 weeks. Maximum 2 weeks. Why? Because a lot of doctors get results that come to them every day from different places. A lot of doctors work in a hospital, work here, work there. How many of those results will they see? And God forbid, your result is the one that falls through the crack, and they don't see it. And bad things happen. So when you set up an appointment, you come in and say, hey, doc, I did my test last week. Because your doctor may write the test for you. Oh, do MRI, do CT scan. He may not know when you did it. You may do it 2 months. We know our people. Sometimes they travel to Nigeria and come back after 3 months before they do it. The doctor would have forgotten. You understand? But if you do the test 3 or 6 months after he asks you to do it, look, follow up with the result. Go sit with the doctor, sit with your doctor, sit, and you review it. You can look, if you can, read the report with him. And we have my chart now. You can look at the report, and look it up and see what it is. You may not understand it, but that's why he's there. He's the one who went to school to read all of those things. Let him come sit with you and have those discussions and discuss with him. All right. So again, follow-up visit. That's the third kind of visit where you did some tests, everything's done. You have to follow up. You check your symptoms, you review your medications, and the continuity of care. One of the things that's so profound, especially for those who are on multiple medications, I've seen people who are on 2 cholesterol medicine or 2 acid reflux medicine. Look, medicines are not benign, and as much as possible, if you have to take them, take the medicines that are meant for you, that will treat specific issues for you, and you know what they're doing for you. If they're not doing anything, why should you be on those meds? Really, you shouldn't. And that's why when you sit with your doctor, you're going to sit and review. It's called medicine reconciliation. You reconcile your medications so that if you see the cardiologist, you see the pulmonologist, you see all of those people, guess what? They'll each write all these medications for you. And you go home and you start taking. Sometimes you get confused. And some of them interact with one another. And they counteract the effect of one thing over another. And some of them will make some medications not work as well as the other ones. Why? Because everything you eat from your stomach goes to your liver. It's your liver that breaks it down, right? So once your liver breaks it down, then it breaks it down to some medications, they specifically design them so that when they get to the liver, that extra shell casing that is there is broken up. The liver breaks it up, and then you get the active ingredient of that medication. And that's how some of them are coded. But guess what? You may take one medication that will induce the cells so that by the time it breaks it down, it's supposed to break it down at 50 cc per hour. Because it's induced, it now breaks it down 70 cc per hour. So the work that it's supposed to do to protect your eyes is no longer doing it. And that's why it's important you sit with your doctor and say, doc, this person gave me this. This person, what do you think about this? He'll reconcile those medications. It's your right. It is your right. They'll reconcile those medications and make sure that you get value or buck for your money. Hold on, let me plug my phone. Sorry. my laptop. Right. So follow-up care, ensuring progress. Again, like I said, always schedule your next appointment. Always. Medication use, follow-up medication use, test results, follow 2 weeks after any test. Importance for follow-up maintenance call, address concerns, and gives you a proactive concern and empowers you to take care of yourself. Every doctor should empower you to take care of yourself and be active in your care. Like I always tell people this, listen, you're with me 15 minutes, maximum 30 minutes at a time, but you're with yourself 24/7. So who knows you better than you? You know yourself better than anybody else. So if you don't know yourself and you don't take care of yourself, then who will? You understand? You're primarily responsible for your own health, you know? So, clarity, understanding, taking control. Signs and symptoms, explanation, treatment plan. When you sit with your doctor, that's when you have to have your treatment plan. You review the test, review the plan, discuss with your doctor. What are the barriers that we have as a people to our care? Um, Insurance issues, insurance coverage. Most of us are of migrant families, and sometimes some of us are undocumented, so we may not have insurance to cover us. A lack of insurance making it difficult to access healthcare or afford medication because these things are so big and profound. But we'll talk a little bit about what we need to do when it comes to insurance coverage, because the United States spends 18% of its GDP on healthcare, four times more than the nearest people who in any developed world. But guess what? Our parameters are still very low for a number of reasons. Slavery is a big issue, which the attendant outcome of what it is to Jim Crow, to segregation, and all the other things that we see along as we come. Language and communication barrier. For those who come to this country and don't speak the English or don't speak the language, again, people who don't understand all of these things, they have poor outcomes. And that's why, look, we are a family, we're a community. If there's any issue, somebody reach out to you, hey doc, or sis, can you help me? Yeah, it's okay. When you're off, take the sister to the clinic or go there, be the advocate for that person. Discrimination and stigma. Some migrant communities avoid seeking healthcare due to fear of discrimination, stigma, and deportation. We have the stigma in our community. We still talked about the what do you call it, the Tuskegee experiment and all that. Transportation issues. Again, social determinants of health, where transportation is a big issue as well. You have 2, 3, 4, 5 children. You have to go see your doctor. Who are you going to leave the children with? And how are you going to go there? Even if you have to take them, if you don't drive, it becomes an issue, especially now when the economy is getting really tight. So, what are the resources available when it comes to accessing healthcare? There are government resources, non-governmental, you have private. Now, the private one, where you have your insurance, you work for a company, they give you healthcare. And sometimes in our community, look, we work in a place, but we don't take the health insurance in that place because we don't want to pay money. For God's sakes, please, it's the easier and the cheapest way because it's a group kind of insurance. The insurance, the company gives it. Pay. How much would it take? You won't even see it coming out of your pay. You understand? So please take those so that you cover yourself. And if it's not you covering yourself, somebody else is covering. Either your wife covers you or you cover your husband or vice versa. And you cover the children. Thank God for Obamacare. It's been extended to age 26 for your children. So before they graduate from college and find a job and then get their own insurance as well. So these are private insurance. And if you don't have one, please, look, it's okay. You can sit with your doctor and negotiate with your doctor. If you have a primary care, it doesn't matter. Like, doc, look, or you lost your insurance or you lost your job. I used to come here, doc, I don't have insurance anymore. A good doctor who you built a relationship will see you or send your medication to the pharmacy without necessarily charging you. And even if they have to charge you, they'll charge you very minimum. So at least they'll see you. And then you have non-governmental, non-profit organization healthcare, where they run free clinics, healthcare programs, community outreaches, that NGOs do. Now, on the government side, you have community health centers. Community health centers are federal health community centers that the federal government has put money down to a certain group of people who will provide health care for those who qualify for it. Sometimes, even if you're 100% or 200% below the poverty line, those are the people who qualify. And if you are undocumented, look, on your phone, just type in right now, Federal Health Qualified Center near me. It's going to show you, whatever state you are, Federal Health Qualified Center near me. It will show you those places. There you can go. And you go, you register. If you don't have money, sometimes they still take people insurance anyways. But if you don't have money, you just go there. Listen, I don't have money. I only have $20. they're not going to turn you away because it's mandated and they'll provide for you. And then, of course, you have Medicaid. If you qualify, if you're a citizen and all that, you qualify, you do it together. And then the CHIP, and then obviously Medicare up to certain age. Or, God forbid, people who are on dialysis, they all get Medicare as well. So these are the resources for accessing healthcare. So when we talked about the barriers, it should no longer be that you have no access to healthcare. I often say this: chase this health and achieving healthcare like somebody owes you money. If somebody owes you money, wherever they go, you're gonna go look for them. Somebody owe you your healthcare. Go chase it and go get it. All right. So the power of community. We are a community. We need to learn to preserve one another and preserve our community. If you're in a church, if you're in a mosque, there are people in the community in that space that need healthcare, that need, things to be shared with them. The information you need to share, the things you've heard today, share this information with them. I always say, look, there's an African adage that says, if you hear good news, you listen with both ears, but not just hearing and listening, but also sharing those information. So, in the community, in your tribal association, in your sorority, wherever you are, share this, because a lot of the time, a lot of us pretend like we know, and we don't. And if you share this information, you'll be shocked. Somebody will call you aside and say, hey, sis, you know what? I heard about this. What do you think or whatever? It's okay. Again, we're community, share this information and let us stay healthy and stay healthy together. Community aid, healthy together. And this is a journey that we must have and pull together as a community. Spiritual wellness, reflecting prayer, soul nutrition, share those things as well. Again, this mental health, we can't be too mindful of mental health. If you see your brother or sister struggling, point them in the right direction. That will help them, give access to them, and let them know. If there's anything, reach out to somebody who knows somebody. There's always somebody who knows somebody. You can get through somebody. You can get through to me. You can get through to Dr. Okwesami and all the other doctors who are here. I'm sure none of us will say no. We won't listen to you. The maximum say, you know what? Let's set up at a time where we can talk. But guess what? If you have a primary doctor, it's okay. You can sit and go meet the doctor. But if you're not convinced that your primary doctor is not saying what you need to hear or how you need to hear it, it's okay to seek for a second opinion. And guess what? Research has showed also that people who are taken care of by people who look like them do better. Period. It's a research. People who are taken care of by people who look like them do better. So take that information and run with it. Eating habits. It's imperative that we must eat because, like I said, eat right. You are what you eat. You are what you eat. We can't overemphasize that. Again, that's why I said earlier on, you don't have to be westernized, even if you're civilized. The food that you know what you eat and research that and make sure you eat them and eat them properly. Regular exercise, cardio, strength, flexibility. We can't overemphasize. Rest, rest, rest. Um, I hear that all the time. People tell me, Dr. Ware, you need to rest. But you know what? I know my body well enough at this point in time. You also need to know your body. It's important. I can sleep for 4 or 5 hours at a time, and I know I'm good with that. But I also know that when I pull it up, there's a day will come that I'll have to sleep for 8. And that's when I decompress. So you have to know yourself and know your routine and how to handle yourself and how to relax and how to exercise and how to surround yourself with pleasurable people who are also good for your mental health. These are the things that holistically make you a healthy person. Stay positive, stay healthy, positive mindset, inner resilience. And how do you build that inner resilience? You do that with emotional intelligence. Again, it helps you to address issues to your issues and conflicts and how somebody addressed them to you. And you will learn how to de-escalate issues when it's going out of hands and addressing those issues to a point where it doesn't affect you mentally to the point where it affects you physically. Because in medicine, we have what they call conversion symptoms and somatization, meaning you're mentally stressed and you're having symptoms. And those what's called somatization. You're so mentally stressed to a point it gives you physical symptoms where even your your arm hurts. One part of your body is weak. Or even have chest pains that they say in Takotsubu. You know, when they say he or she died of a broken heart. Yes, that's emotional stress to a point where it affects the body, it gives you symptoms. That's what conversion is all about. So, emotional intelligence, if you don't know what it is today, Google it up and listen to some of those stuff on YouTube. It will give you those things that will help you build your resilience. Your health is your wealth. Prioritize your well-being, invest wisely. Good health and true health is important. The final thought, embrace what you have. Your faith, prioritize your wellness, spiritual, soul, body, stay positive, stay in God's grace. And I will say this, take care of your body. It is the only place you have to live in. Take care of your body. It's the only place you have to live in. And I say thank you and God bless.
Thank you so much. Wow. That was deep. And thank you for taking us back to history. Dr. Aluya, thank you so much because you took us to the basics, from history. But before I call, I just wanted to add Ben Carson to that list. He became the youngest chief of medicine, chief of pediatric neurosurgeon at Johns Hopkins at the age of 33. I can't even fathom it, in 1984. And in 1987, he led the team of surgeons in the first ever conjoined twin separation. I think they were conjoined in the back of their head at that time. That was the first ever that was done. He also performed the first successful neurosurgical procedure in a fetus inside the womb. He's been named so many things, I think CNN, Time Magazine named him one of the nation's 20 foremost physicians and scientists, and the Library of Congress on their 200th anniversary named him as one of 89 living legends. Is our brother. It pays setting. Amazing. But Dr. Motoshaw, before I call you, I want to say that Dr. In the platform, Dr. Anil Kalfani said, women, keep your cell phones off your breasts. And when I read them, like, whoa, I've seen that where women will put their cell phone in their bra. Please keep it away. Don't let's nudge breast cancer, as Dr. Aluya was talking about, the mammogram imaging and all of that. He put that in the chat box. Dr. Motoshaw, kindly unmute.
Oh, wow. Well, Dr. O, thank you so much.
Thank you, sir.
Well, I don't know where to start from, but then let me first of all address you. Friday was phenomenal, and I'll leave it at that. It was phenomenal. I listened to the young adults speaking so wonderfully, and thank you so much for what you're doing and what you continue to do. I wasn't expecting that we have this today. And interestingly, listening to Dr. Aluya taking us through memory lane, I don't know how he did it, but he packed a lot into this topic. And packing a lot into it, I just want to add something and then asking one or two questions. The first thing, it's when he said something at the, let me say at the end of it, in the middle, and also at the beginning, he quoted quite a number of Bible passages, right? And he talked about emotional intelligence. However, it is my understanding that the physiological body, we can check the temperature. But for the spiritual being, there is no thermometer to check our spiritual temperature, which is needed. I would like him to clarify a little bit what he thinks, because I just felt personally that when it comes to the spirituality of the body, doctors doesn't have a stake in it, because most of us, most of the patients, even when they choose their doctor, they don't ask what's your spirituality, what's the spirituality of their doctor. So that's why I say we don't have a stake, meaning that a patient cannot go to the doctor and say, can you tell me my spiritual temperature? But physical temperature, physical blood pressure, we can. But when it comes to that spiritual part of it, I always defer that to the pastors and various religion that people believes in. But that conversation is also being had. So I would like him to please to try to separate that a little bit, because even with the emotional intelligence, it requires a lot of wisdom. And some of this screening that we do or we ask patients to do involves a lot of wisdom. And finally, I would like him to also tell us a little bit about the reality where we are today concerning the federal government when it comes to equity and what is happening with our own population, meaning Black and brown, which we know that most of the urgent care and the FQHC get a lot of money from the federal government, and they are rolling out different protocols for them. How will that help our own community, or what does he think we can do based on his experience? I know I might have asked about three in one questions. Thank you for the time.
He can handle it. Yes,
Thanks,
Dr. Aluya.
thanks, Dr. Mutasho. With great honor and respect to you, and thank you for coming on. On the spiritual aspect of it, if you notice, when I talked about the visit, there was no spiritual aspect of it. I never mentioned any spiritual thing when I talked about the visit. It was very separate. But when I talked about the spiritual aspect of it, I was referring directly to you as an individual, how you as a person will connect with your own spirituality. I have mine. You don't know if the God that I serve is still related to my ancestors. And that's one thing that we need to evaluate and reassess as well. So your spirituality is yours, and how you deal with it when it comes to you. However, as a medical doctor, I understand that you also are a spirit being, and I will listen to you and hear where you're coming from. Because what happens is this: a lot of the time, as you and I know, that the spiritual persuasion that we have as people can also drive the decisions that we make in our healthcare. So if you're going to tell me, hey, doc, I'm fasting. Somebody told me today, I'm fasting. It's the Azumi time. Doc, how would I relate this with my medication? I understood that. I said, look, I know you're fasting and all that, but this is how you need to do it. Take your medicine so and so, like this, like that, like that. They're like, you know what, doc? I never thought about that. Thank you very much. Why? Because growing up in Nigeria and school in Ahmadu Bello, I fasted with some of these people who fasted. I broke fast with them as well. So it was easy for me to understand where they're coming from. But if you do not know, just say it's okay, I don't know. But at the end of it all, you as a person will have to be responsible for your own spiritual sanity. But in me saying what I said, it's a two totally different thing, not for the doctor to impose your spiritual persuasion or perfection on the patient, no, but for you to understand that that your whole being, your healthcare, is also physical, is also spiritual, is also emotional. That's one. Two, to the second question on emotional intelligence, yes. Again, just like medicine, it took all these years from elementary, secondary, or high school to university and then residency before you graduated. Back in the days before we got to work, medicine was an apprenticeship. It is. Not everybody coming, just like today, not everybody can go into medicine. You have to qualify. Back in the days, you have to qualify for me to take you as an apprentice. And that's why they call it residency. You have to. So it's a process. The same thing with building your emotional intelligence and resilience. It's a process. But guess what? The democratization of knowledge has made it possible. What I mean democratization of knowledge is that knowledge is now also in our palm. So what you do is easy, reference, go to a place, type it in emotional intelligence. Just listen and listen. You can do emotional intelligence for the dummies. Those things are there. Then you begin to learn. As you learn, you grow on to the point where you understand, you're able to make those decisions, and eventually build that resilience. It's not a one-day thing, it's a journey as we go on. Now, to your third question on healthcare, where we are today. Yes, one of the largest federal health qualified center here was panicking when President Trump said what he said about, hey, we're cutting federal whatever and all that and all that. And they were saying, oh, what are we going to do in paying the staff and all that and all that. Yeah, I hear that. However, the Federal Health Qualified Center, in all sincerity, the way the thing is run, people don't understand. You can, so let me take it this way. They're federal health qualified like centers. They're not FQAC yet. They're FQAC like centers, right? So that's one step. And then you have FQACs. Now, the federal government may give you $5 million. That's all they give you to start your business. The $5 million you use to start really small and then begin to grow to where you can be, where you rent, you hire people and all that. However, a lot of the other things that go around also come with grants. And that's where, as a federal health qualified center, you have to learn and have people how you write grants. These federal grants are really exclusive to federal institutions where who qualify. So they run those things with you. You apply, you qualify, you get. So all of those grants together as what these health centers use to run their organization. However, I've seen across board where before now, the federal government decided to do things differently. They used to give these grants, right? And when they give these grants, you know what the people do the grants? They use the grants to pay salaries. And ideally, it shouldn't be. And I've always felt bad about that. They put this money, they pay salaries, they hire they hire more nurses, they hire more physicians, the MPs. But the fundamental reason for system change is not taking place because they want to grow. They want to be the biggest FQC. They want to be the biggest. They want to be. No. So what the federal government started doing before Trump, 2-3 years ago, they give what they call catalyst grants. A catalyst grant is I give you the money, you tell me what you're going to do. But what you're going to do is what are the outcomes that you're going to pursue that will result in system change. When I heard that, I was so happy with that because you know what? These things affect our community and we're not seeing the changes. Catalyst grants are going to do that. So hopefully as the system comes, it's not going to change, FQACs, and FQACs should find ways of what? Sustaining themselves as well. You understand? So you just don't rely on the federal grants. If you rely on the federal grant, collect that money and pay your staff, then there's a problem. You understand? So that's how these things are. So again, in our community, you and I are the ones who will look for ways, see where there are problems in our community and solve those problems. Dr. Kwesemi is solving the problem in our community with this platform because there's a gap in information. This is one problem she identified and she's feeling it. So in our community, each and every one of us, whether you're a doctor or you're allied healthcare worker, look for the problems that live that in your community and find solutions to it. And finding solutions, you look for the resources. And some of you have heard me say this before. Resources to solving those problems time, money, and intellect. Because guess what? Some people will give you the money, they will not give you the intellect. You look for those who will give you the intellect, meaning the skills of how to solve it, and others will give you the time. They may not have the money to give you or the intellect, but they will work for you to do that. And that's the answer I give to all that. Thank you.
Thank you.
Thank you so much. Follow up to that, federally qualified health center, I think they're partially federally funded, correct?
Correct.
They're not fully funded by the government. Okay. So we don't know what would happen with them with all these cuts, but it's still a great resource. I purposely, mentioned that so that, again, as Dr. Aluya said, for people who may be undocumented or, you don't have insurance, it's a place to go. They must not ask you for your
For your
paper,
documentation or status, no.
for your status. They must not. I was chief of medicine in one for 6 years, and I know that for a fact in Baltimore, that we are mandated not to ask for documentation. Based on where you are, like Dr. Aluya said, I don't think they charge anyone more than $20, $24 per visit. And that covers blood work, if you have dental issue, eye, ophthalmology, everything. It covers whatever you may need.
And for medication too, there's a program, it's called the 340B, where for the 340B, those medication that you get, they give you for 10% of the cost. 10% of the cost. So if something's $200, it'll come down to what? $20. If it's something's $20, you pay $2. So that's what the federal government has mandated for years. So and like I said, just Google it. FQAC near me. You're gonna see them all around, and you choose the one that's closer to your house, to your home, and then you attend those ones if you don't have insurance or you don't have healthcare.
Fantastic. Fantastic. I'm so glad. Dr. Kalfani, kindly unmute because I saw your post in the chat box. Please talk about that a bit.
Sure. I was actually going to ask a question, but I'll talk about that briefly. We have this African spirituality conference that we have been doing for 7, 8 years now, and I just posted in the chat that if we want to check on our spiritual health, that we can do that. We just have to look at our different modalities, especially if we're looking at traditional African and indigenous Native American. We have lots of tools and resources at our disposal to actually check in on those kinds of things and to use them. In fact, if you look at in some traditions, that those people who are traditional spiritualists are also health practitioners. And so when we look at those diverse modalities, that it is a more holistic approach to doing so than is taught in school today. I wanted to suggest, and ask. One was that you have Dr. Aluya talked about some of the early people, and I appreciate that. I just wanted to add to that none other than Imhotep, who was actually the first medical person, African medical person, but medical person, period, back 2,500 years BC. And they still have his medical in both the British and the Cairo Museum, where he was doing surgeries back thousands of years ago. So Africans have always been doing healthcare. My question to you was thinking about the two things I just mentioned. Where do you see our traditional ideas about herbal medicines and the bridge between the spiritual and the allopathic medicine that we oftentimes ignore because of the presence of a Eurocentric idea about modern or allopathic medicine? That may
Right.
be a whole talk in itself, but I
Right.
think that we just want to see.
It is. And I think I gave a talk sometime where I had to remind people that before the white man came to Africa, we had people who were medicine men, and their job is they knew the herbs, they knew, the roots and all of those things. They knew them because you know what? It was passed down from generation to generation to generation. If you look at the Bible, it was the same thing too. Even in Europe, it was the same thing. But you see, with the revolution and westernization that was intermixed with racism and all that happened in the 1600s, in order to totally subdue and subjugate the black man, they needed to take all that the black man has and decimated it. And decimated it to the point where there were those who were spiritualists. The people who commune with God. Straight up. They were not herbalists. They were not herbal people who treated people on a daily to day basis, where if you have to deliver, they'll come, they'll give you medicine and they'll take and they'll help your delivery come up well. We had oxytocin back in the days and all that. You understand? And our mothers gave those things. Our herbalists gave those. They treated diabetes. They treated kidney disease. You understand? They were herbalists. But there were people who were also spiritualists. They communed with the spirit and got knowledge about the weather and everything else. And look, Samuel in the Bible was one of them. Eli was one of them. They heard messages for the guidance of the community, the safety of the community. You understand? So, but when they came, they lumped all together and made them all evil. And imbibe that in our head. What it is that you have is not good. So they broke that down. And this is where we are today because they needed to do that to decimate and control and subjugate us. However, you see, things are coming around. And some of you who have read the post I've said that God is science and science is God. You can't separate both. But God uses science to manifest and reveal himself every day. And one of that is artificial intelligence. So when you talk about the spirituality and herb, guess what's going to happen one of these days? They will take this herb and run them chemically, and the AI will analyze these herbs and differentiate them and tell you which and what component is in the egusi leaf that's good for you, or is in the bitter leaf that's good for you, or what our forefathers knew back then that were used to treat diabetes, but the white man came and destroyed. Now we begin to use these herbs and leaves and whatever. The AI will analyze those things for you so quickly to the point where it becomes the democratization of medicine. If you hear when I say when you democratize everything, it means it becomes to your, you have access to it quickly. And that's what AI will do in the future, where people who are smart, like my brother Kalfani and all that, will instruct people and lead people to a point where we'll be able to use AI to go back to our roots, analyze our herbs and our roots and everything else, so that when we drink it, it protects us from diabetes, protect us or whatever. So that's what I see coming up in the future. And you begin to see that people, when it comes to spirituality and everything, they're two different things. And people need to understand it. There's religion and there's spirituality. We need to know that there's religion, which is the practice and the principle upon which you have access to God, which is the spirituality. And some of them, unfortunately, that's all been corrupted, like everything else. But spirituality is still very pure. And that's why when the Bible says when he was living, he left you with the Holy Spirit, because that's who will commune with you. You understand? And that's the spirit that you have that talks to your soul, which God gives you. So when you leave, God takes his spirit, but your soul is what is the consciousness, who you are. But then that's another discussion entirely. But we're getting to a point where science is opening all of those tools and doors to us. But we must have people who continue to stand in the gap to instruct and elevate our people and tell the people our truth. Just like we are standing in the gap in medicine today, telling the people the truth about medicine. 20, 30, 40, 100 years from, we didn't have doctors like this as we have today. And that's why they were able to do what they did with Tuskegee and with the pap smear and all of this. Those things will no longer happen today because we have people who are standing in the gap. So that's why you and I will also have to learn to raise people who stand in the gap in science as God manifests himself to us through science.
Oof. Thank you so much. It's a journey. We're still in it. We're on it. Dr. Izugu, kindly unmute.
Captain Aluya. As always, very detailed and very mind stimulated. Thank you so much for your presentation, and thank you for really bringing many things to forefront. There's one of your slides I want to capitalize on, which was your slide where you mentioned prevention, early detection, and continuation. See, that's so important that many will wait till they get symptoms before they start seeking help, medical care, help or care or seeking for that. But the goal is to go even before that and really focus on prevention, early detection, and then actually maintenance of good health with many ways, whether it's exercise, whatever you have to do to maintain that. Because the time you started having symptoms, when the disease has settled, it has now become your portion. And it's normally time to say, it's not my portion, I'm not going to do anything. In order not to make it your portion, take care of it ahead of time. And when it comes to spirituality and health, I'm going to talk more from the cardiovascular, cardiovascular disease and studies. We have evidence that people who actually are religiously inclined, they go to churches, they pray, they have association, they actually cope much better, when it comes to cardiovascular survival and cardiovascular health. So I don't have any qualms discussing, religious issues with patients in my office. As a matter of fact, some of them will come and say, let's pray, okay? Because sometimes some of the decisions we have to go through, sometimes the decision for them to do certain procedures in the major, with high risks, there is no other way to make that recommendation and have a clean conscience without prayers with them and understand that God will take care of it when they go for those procedures. And for them to understand that God provides those individuals with the skill to make that thing happen and make them whole again to continue their medicine. So, thank you again for the presentation, and I will stop there and we'll carry on. Thanks.
Thank you. Thank you, Dr. Izugu. For physicians here on the platform, I know you know this, that there's a research that was done on hospitalized patients, and they compared those who pray to those who didn't, and found out that those who pray they spent less time in the hospital, their issues resolved faster. All the end goals that they looked for was just better in those who prayed than those who didn't. So, Dr. Kalfani, I hope that helps to, answer your question better.
If I may add to that, one of the things we don't know, we begin to really explore and see this, that there are physiological changes that take place when you commune with a higher level. Physiological. And when you mean physiological, meaning at the enzyme level. So those things that causes decarbolization or methylation, those are things for those who did biochemistry and all that, you understand? And that take place to the point where even the receptors, because that's what happens to the release of chemicals and the enzymes that help break down those things are actually thrown into effect that are pleasurable when you commune with the higher being. You understand? So we begin to see all of those things now. And that's why emotional issues tend to affect the physical. I talked about the Takotsubo, broken heart. We grew up, they say, oh, she died of a broken heart. Guess what? Now in 2004, when the word Takotsubo this described after the Japanese what they call fishing port, that's what it's called. That when you have severe emotional stress, that your heart balloons out. The anterior aspect of the heart balloons out, and that's what gives the chest pain. You understand? So we never knew this, but now we begin to know. So the physiological aspect and the spiritual aspect and all of these things are beginning to manifest so that at the elemental level, we'll begin to see these changes, the chemical reaction and inflammation, which is big. Those who commune with their higher being have less inflammation compared to those who don't.
I just know that prayer is very important. And faith in God through Jesus is amazing. So, Dr. Aluya, this has been so impactful and so educational. A lot of people are commenting, thanking you on the platform. But I want to single out Auntie Susan. You know, she's in Nigeria and she's off. She said, thank you, Dr. Aluya, for the simplified, interesting, and humorous outlay of taking care of ourselves, as it is the only body we have to live in. Thank you again. It's been worth staying up late in Nigeria to listen to you, she said. God bless. And then she wrote again that I missed the other one. She wrote something again. Anyways, she's appreciative. She said before to me that, oh, she said, good point, Dr. Aluya, concerning AI analysis of our herbs and foods. She said she could not miss your talk for the world. Now, even though she was tired, she's going to stay up. And she did. She's still up. So I wanted you to know that she's in Nigeria. she's visiting Nigeria.
Thank you. Thank you.
So, Sister Rosemary, go ahead. Kindly unmute.
Yes, thank you so much, Dr. Aluya. Domo, domo, mate domo. I'm not talking it up. Thank you so much, because what you just said today about spirituality is so important, because I'm a faith-based therapist, and 92% of my clients get their healing. Okay, and I also show them a lot of love, because we human beings are made up of spirit, soul, and body, and your soul consists of your mind, will, and emotion. So it is good for us to take care of our mind, will, and emotion, because it's connected to the spirit. And a merry heart doeth good like medicine, and a broken spirit dries up the bones. The word of God is life unto us, and it's life unto us, and Lord of God is life unto us, and it helps us with our broken bones and all the rest of them. So it is very, very important, because in my practice, I help people to help them to understand how to use their spiritual beliefs to significantly influence their mental and their emotional well-being. So, you using spirituality in your practice and everything is so important that, doctors will spend time, with their patients to really love them and pay attention to them in that present moment. That will help the patients in their healing also. Thank you so much, and God bless you. All right. Maybe one of these days I'll give my own talk here.
I'm looking forward to that. Finally.
It's gonna come.
So much. Thank you. And I actually, I've been a witness to several people that the Lord has used Sister Rosemary to turn around. I have referred so many people to her myself, and with excellent results. It's very important that, we stay in tune with Christ. I mean, there's no mixing words no two corners there. Thank you. Thank you for that, for that uplifting contribution. Thank you. I appreciate it. That is that Papa Mike Oye?
I am here.
Welcome, sir. Good evening.
Dr. Aluya, God bless you.
Thank you. Thank you, sir.
I've enjoyed every bit of it. I am particularly encouraged that Orthodox medical doctors are attaching spirituality to the healing process right now. I do a lot of counseling and a lot of intercessory prayers for people. And I use herbs to treat different diseases. And in my counseling, I find people who are even demon possessed. And by the power of the Holy Spirit, I bind and cast out the demons. Amen. So all these things are to be integrated. And we can learn many things from different angles and present a very holistic approach. All right. For bringing holistic healing to body, mind, and spirit. I am really happy that we are getting on in this way. Kudos.
Thank you, sir. Thank you so much, sir. In case we all don't know, Dr. Mike Oye is a naturopath. And when Dr. Kalfani was talking about, the allopathic medicine, herbs, and all of that, he actually crossed my mind that on Medical Mondays, Papa Dr. Mike Oye, I've been here several times to educate us on different herbs and, using herbs as interventions in certain disease entities.
Can I add something, please?
Yes, sir. Go ahead, sir.
From 1959 to date, there is a book I've been using to do research into herbs in Africa. And I would like to recommend the volumes to people on this platform. If they can get them, it will help a lot. The title is Useful Plants of Tropical West Africa. Useful Plants of Tropical West Africa. Volumes 1 to 5. And each volume is bigger than the Bible. Thousands of plants have been researched over 300 years ago, everything documented, and it is indigenous knowledge from Africa. Many of the pharmaceutical things happening today have come from such books. The Europeans did a lot of research in West Africa, in East Africa, in South Africa, in Asia. And they have volumes like that for different parts of the world. It is from this that they have been taking all types of things to manufacture many things for the world. So we can go back to our roots and do a lot of research to refine what our ancestors did and gain a lot. We need independence in the medical field. We really need independence. Now, there are many authors for those books, but the editor is Burkill, B-U-R-K-I-L-L. Burkill, B-U-R-K-I-L-L. You can Google these things and you can order the books right in America here. I think later on they may become extinct. So if we can get them now, it's going to be a compendium for the future. Thank you.
Wow. Thank you so very much, sir. Appreciate that. I put that in the chat box for everyone. We'll get it, sir. So, Dr. Aluya, Dr. Popola wrote some things in the platform. Dr. Popola, I don't know if you're still on. I couldn't make them out. I think one of them is, could the medical education disparity be related to lack of funding? But I don't know. I think there are many reasons why there is the medical education disparity. But Dr. Aluya, do you want to comment on that?
Well, I mean,
especially amongst the Black males.
Right. So the number of Black men, the percentage of Black men in medicine in 1932, they say was 3.5%. The percentage of Black men in medicine in 2001 was 3.8%. So you can imagine that. All these years, that percentage never really went anywhere. So that's the beginning of our disparity. If you don't have people who look like you, they'll take care of you, because studies shown that you're more likely to do well when you're taking care of people who look like you. That's the original study was done in the neonatology, in the NICU, where children who were taken care of by Black folks as compared with Black children who were taken care of by white folks. After a year, the outcome was much better for those who were taken care of by Black doctors. So, and then they went to reprieve those studies subsequently. So, if we don't have enough people who are like us, who are in these spaces, advocating for us, then that's where the disparity comes. If you get into a place where decisions are made and how to disburse money or whatever, or how to put money into the community, and you don't have people who look like you, who act like you, who will talk for your interests, forget it. You're not going to get that money. So we have to be there at the table. That's why they talk about the proverbial table. You have to be at the table. And it's our communal responsibility, meaning the community, that ought to be responsible to raising those who sit at individual tables for us in healthcare, in finance, in STEM, in all law, in legality, in all. That's what these people have done. The Chinese have understood that. They're doing it. The Indians are knowing that now. They're doing it. The Vietnamese are doing that. Where's our people? You know, and we need to begin to reconcile the differences that is amongst us and look for the greater cause and the greater need, you know, that unifies us than the pettiness that separates us. Oh, I'm African American. I ain't got nothing to do with y'all who from Africa. Or, oh, I'm from Africa. Listen, you guys are lazy and whatever. No, because as I said this, I think last year when I gave a talk on Black history, look, when they came and stole those young, bright men and women out of Africa, and they were despondent and angry and painful and came here to see slavery and all that, guess what? Those children who were taken from their mothers and fathers back home, none of those women died happy. Those who were left in Africa, the mothers, the fathers, their brothers, they never died happy. A lot of them wondered until the day they died, still looking for those children who were taken away. So there was pain on both sides. There was pain on both sides. We must begin to understand that as well. Not, oh, you guys sold us off. No, you were stolen and I was hurt. And I look for you every day. And maybe that's why they talk about the storm that comes all the way to the coast of West Africa. That's the storm and the cry of our mothers coming from West Africa to America, crying every day, every year for children who were stolen. You know? So again, that's a different kind of talk. We can talk about that. But these are issues that we must come to reconcile, internal reconciliation, and then, you know, begin to find the strategy that we will as a people put together to advance us as a people.
We are brothers and sisters. Thank you. Thank you. And we need that bond
more now than ever.
more. Thank you. I love how how you always complete my sentences. Thank you. My true brother. So, Brother Taye, thank you, sir. Mr. Taye Doherty, already put in the chat box that The Useful Plants of West Tropical Africa is an extensive 6-volume work that offers detailed information on over 5,000 plant species found in West Tropical Africa. Each volume is organized alphabetically by plant family, providing descriptions, distribution ranges, habitats, and economic uses of the plants. And Dr. Omotosho, nailed it in for us that, Baba, the price for one volume of the book, volume 1, on Amazon is $120. And it is on back order, sir. Is there any other ways to get it cheaper, sir? Papa Mike, sir.
Just give me 2 minutes more for program.
Well, that's where when we talked about AI, at least somebody somewhere today would instruct their child or grandchild to look into this book and use AI to analyze those, because it will do it in what, the whole volume, analyze it in what, a day. It will.
So
That's what AI will do.
I have a question, a serious question. What if we get this box? Volume 1 is $120. What if we get it? Can AI help us somehow to be able to now, share it wildly amongst our people who may need it?
I mean, I think it's to get a summary of what the book looks like, and summarize it. I'm sure it may be a little dense. When I mean dense, meaning they have their technical names that they have that the average person may not understand. So, but the fact is, somebody will be commissioned for each one of those, those plants before they go extinct, for God's sake. And this is the time where somebody should be commissioned to go look for those plants and pick all of those plants and keep them somewhere. You know that.
We delegate you, Dr. Aluya.
All right. No, but that's a question we must begin to do. Look, God bless me. I have the money. I'll commission somebody to do that so that they begin to, because guess what? Do you know every grain, every plant on earth has been put together and they have it in the Arctic region. There's a place, there's a book in the Arctic region that those things have been put. And the multiple governments put money together to keep that place going. It's all up there. How many of our plants are there? That's the iron. We don't even know.
The Chinese might be ahead of us. That's why they're in the bushes of Nigeria. They're cataloging all of those things. Yeah.
Yeah.
Right.
Stealing all this intelligence.
Yep. Dr. Ajagbe, you have your hand raised, sir. Kindly unmute. Dr. Ajagbe, thank you.
Well, thank you. It's been
Your camera is not on.
Yes, I know.
Oh, okay.
Thank you for all the exchanges. I think I posted something on the chat. It's the first page of the archived copy of the floras of plants of West Africa, tropical West Africa. So it was compiled by a team of botanists, and you will see it's probably the same thing that
it is not, Dr. Ajagbe. Just so you know.
Just take a look. You don't know what I've just posted. Have you seen it?
It is not posted. It did not make it to the chat box.
It's there.
Okay.
All right. Anyway,
anybody
there
else?
is what I want to suggest is that there are digital copies of all these documents in the archives, and you may be able to download some of them, and so They're available.
Okay.
Thank you very much for the information.
Yeah. We'll commission somebody to AI analyze them. That's all. See, they have a digital copy.
You have been commissioned.
Yeah, I
Dr.
have. In
Aluya.
fact, I'm actually thinking about it. I have a young man who is doing incredible work using AI in Nigeria. Just met him recently. So this is something I could. He's looking for work to do, so I could,
You could commission into it. That's fantastic. So if you please give us your closing remarks. But before you do that,
you go. I had something to mention, Dr. O.
Go ahead, Dr. Buka.
Yeah. I
Your,
know
your,
we're
cam- your
talking.
camera is not on too. Is it deliberate?
No, just two comments.
Okay.
We talk about our people. We have a Nigerian doctor, I think it's Olutoye, who actually performed the surgery on the baby while in utero. And then they closed the mother again. You remember that? So
Yes,
we need to
that was
mention.
recent. That was
in
recent. Yeah.
Texas. I think now he's in Ohio. So we need to mention him.
Thank
And
you.
what I usually say to young people in their 20s, see a doctor early. Don't wait until you have problems. Let the doctor tell you you're healthy. And thirdly, people who are getting older need to realize as you go on Medicare, you have to be on health insurance or you would be penalized. So if you're approaching Medicare, you must be on health insurance. So if they're not, they should try to get it a couple years before, or you will be penalized for the rest. They would deduct money from you every month because you were not covered.
Thank you.
So they need to know that.
Thank you.
Thank you.
Thank you so much. Madam CEO, Madam VP, kindly unmute. That's our mama pack.
Thank you, Dr. O. I just wanted to add Dr. Phoebe. I don't know if you guys know of Dr. Phoebe. He created a pouch that took care of fibroid. He's from Sierra Leone. So
Dr. Phoebe?
F-O-B-I. Dr. Phoebe. He cured a lot of people here in California. So these are people making strides in our community.
Thank you so much.
You can put my name down. I'm working on my own invention.
Yes, so we are waiting. We are waiting. We just got a glimpse of you. Beautiful you. Thank you so much for showing that camera. Thank you. So before I bring Dr. Aluya back again, I just want to say thank you so much for our Medical Mondays family, for your strong support of me physically and virtually on Friday, February 28th at my husband's service of songs. I appreciate you all. I appreciate your presence. I appreciate every way you have supported me. So many of you have zelled me money, just zelled me money. And I appreciate it so much to assist me in my husband's burial. I'll keep you updated on funerals in Nigeria. Don't come. I'm not saying come, but we'll make sure that we provide virtual link and for you to see, and it will be streamed on YouTube. The 2 days in Nigeria. Thank you so much. I'm so privileged to have you as family. God bless you all. Thank you. Dr. Aluya, kindly give us your parting words.
Well, thank you. First, I must say thank you to you, Dr. U, for all that you've done and you continue to do. Like I said earlier on, you found a gap and you knew there was a problem. So you found a reason to provide solutions to that problem. And the problem is a gap in knowledge and bringing people together and everybody knowing one another. And that's why in one of the slides, we talked about the power of the community. You can't overemphasize that. Our community should be strong. It is strong, but it needs to be bigger and better, stronger. And the knowledge that each and every one of us have, we have to pull it together and create the resources that will advance us as a people. And when I say as a people, and I did mention that, so that when your grandchildren, my grandchildren, walk down the street, they will evaluate them based on the character of their individual selves and not just on the color of their skin. Take care of yourself, have a holistic approach to your care, be diligent in your care, document, document, document. But above that, get a primary care doctor, research one adequately, and if possible, get somebody who knows somebody who knows somebody who will give you a great one. Because people who have primary doctors live longer and better and more prosperously than those who don't, period. And in doing that, all the 5 things I say you need to do when you see a doctor, you need to ask the right question, communicate with your doctor, make sure they screen you for diabetes and kidney disease, because they're very two peculiar things that affect us as a people. And exercise every day, because the black muscle, that beautiful brown muscle that we have, is God's gift to us. That makes us fast, but you have to move it so that you can live healthy. I'm not saying go, do run marathon and all that, but just have a routine exercise that you do every day that you can up and down. At least it becomes a part of you on a daily basis. And as you do that, understand that we're a community. We need to protect one another. If you see there's a person who's need, either physically, emotionally, spiritually, be there to help that person. Let's form our community. Let it be bigger, stronger, better. And to a point where we can help elevate us as a people together and take this great journey of good health together. And as we do that, we raise young ones who will take our spots for those who are coming. It doesn't have to be your grandchild alone. Anybody who you see who has the talent and the skills, support that person. And if you can't by yourself, find the resources, time, money, and intellect to do that. So that as a people, we are better and we better take care of our health. And find ways where, as technology comes, we must understand technology, know technology, understand technology, adopt technology, but more importantly, and utilize technology, because these things are coming at us. If you're not well informed and not up to date, you become irrelevant. And things that are irrelevant are what become discarded. And God forbid that's what is done to us as a people.
Obsolete, yeah.
Down on us every day because they feel we have nothing to offer. No, we're proving them wrong every day right now, that we have a whole lot to offer. And not just to offer, we have offered. So we must step back to our roots. Like I said earlier on, let that branch know they're part of the tree. That the fruits and the yield that that branch gets, that makes the leaf bright and grow, is coming from that branch. And it is okay to be civilized. You don't have to be westernized. Know the things that give you pleasure and the things that sustain you, and those are the things that you have to keep. And at the end, also know and take care of your body, because it's the only place you have to live. Thank you, and God bless you.
Dr. Aluya, thank you for the way you framed it, at least regarding Dr. O. This is one of the silver linings of COVID, and it has to do with preparation. She leveraged the knowledge that she has and collaborated with people like you and other doctors that have come to speak to us on this platform. So she too should go down in history for bridging the gap in terms of information, communication, and sharing. We love you. We appreciate you. And even in spite of what you're going through right now, you make sure that this road show continues. The Lord will strengthen you. Dr. Aluya, thank you for your, I don't know where Mr. Duarte learned how to share heart. Mr. Duarte, man, you have surpassed me in technology, this one. Well, and all the wonderful people that Dr. O has always called on to come to share with us. Thank you. The world will never be the same. At least our community will never be the same without you. We're moving forward.
Yeah.
Love you all. Good night.
Love you, man. Thank you so much, man. Thank you, man. Yeah.
Great. Thank
Thank
you.
you so much. It has been amazing. And till we meet again next week, till we see next week, please stay safe. I know
Thank you all.
that at least one of our members is still home today.